Thanks everybody for coming today. It sounds like there are a lot of people who are interested in collaborating just based on the last couple of talks that we heard. So I'm excited to introduce a new concept or potentially expand on a concept you're already familiar with. It's called network analysis. And I'm going to be discussing how you can use it to strengthen partnerships for medical education by giving you an example of what we're doing in our mental and behavioral health training project. Before we get into it, this project was funded by the Health Resources and Services Administration, so the contents of this presentation are mine and don't represent the official views of the US government. Anyways, I guess I should probably also introduce myself. My name is Elena Gardner, and I'm an evaluation specialist and doctoral student in the Department of Family and Preventive Medicine. And I work with the Division of Family Medicine on this project because I'm really interested in how we bridge public health and primary care. How do we get the care to the people who need it when they need it? And family medicine is a really interesting place for me to be exploring this because of the way they are frontline in the health system. It's a really unique venue for public health and prevention because of the way family medicine doctors operate and the people that they see. So across the lifespan, you might have a handful of family providers. They really are aware of how things change throughout your lifetime, and for mental and behavioral health, I think that makes it a really unique venue to establish a deep relationship with your patient and really understand when things are changing with their mental and behavioral health. Primary care and family medicine is also a really important venue for even entering the healthcare system at large. Most appointments are in primary care are with family medicine physicians. There were 200 million visits to family medicine physicians in 2017. But the issue is that this gap exists between the proportion of visits and the number of people in the workforce who can meet the need. I'm only adjacent to family medicine, I'm not a clinician, and I'm stressed about all the things that they have to do in a visit. And on top of it, in our academic system, the physicians are also teaching on top of all of that. These scarce resources, including time to do the teaching, is indicative that it's time to leverage the partners, and it's time to leverage your network to ask for help. This is just like what you would do if you're a physician who's referring to a specialist or consulting with a peer. Our team does this with resident education in mental and behavioral health. And we do this by sending our residents to train with community partners. So this is our resident physician up here on the screen. We send them to community partners because they're the experts on the ground in some really niche topics that we just can't cover in family medicine all the time. So for example, we'll send them to the Children's Center of Utah to rotate and learn about early childhood mental and behavioral health. We'll also have New Horizons Crisis Center come and provide a didactic on inter-partner violence and how to prevent that. We also work with many other community-based organizations across the state in Utah. We have partners in suicide prevention, partners in rural health, all over the place. And without them, we wouldn't be able to train the residents as well as we have. It's really hard to establish these partnerships though, and it's even harder to sustain them. It takes a lot of effort to do this. And it's even harder if you set out with a vague goal to just improve partnerships or form a partnership. Where would you start with all of these organizations? It also doesn't help that without any more information, we're kind of stuck assuming that this is what our network of partner looks like. We're assuming that we're just sending the residents out into the community. Maybe they come back with some more information. But we're also just limiting ourselves with this perspective. We have no idea about the overall capacity of the network. We don't know how we could maybe work together to further our overall goal of improving mental and behavioral health for the community. I think that This perspective can really entrench us deeper into some of those academic silos that I'm sure we've all experienced, and that perpetuates a cycle of resource waste, wasting time, duplicating efforts, and I'm sure we've all been frustrated by that before. What if there was a tool to systematically understand our network partners and how they work with us and with each other? You're so lucky, because today, this is what I hope to tell you all about. This tool is called network analysis, and my aim today is to introduce this method to you all and hopefully encourage you to try one out in your own projects based on what we have been working on so far. So you can already see this is an example network plot, and this is what you get when you finish your network analysis. You can already see this is much different than what you might have been assuming before in that original kind of spiderweb model. A network analysis is a method of collecting and analyzing data from multiple organizations that might be interacting with one another. You can think about this as like your social media network, except it's organizations instead of friends on Facebook. The unit of analysis in a network analysis is not the organization itself, though. It's the relationships between organizations. And we learn a lot just looking at these plots. So you can learn about dyads, which are two organizations that are linked. These are the small but mighty building blocks of larger networks. We also learn about cliques and clusters. These are 3 or more fully linked organizations. We also learn about the characteristics of the network and some ways to measure that are density, which is the overall connectedness in the network. It could be either 0% to 100% connected. We can measure centrality, which is the most involved network or organization in the network. It's the person with the most number of ties. My hypothesis is that it's going to be us in the residency program. And we also can examine the multiplexity of the network, the strength of the relationships, which is based on the number and the types of ties. And these next couple of slides are where we are in this process. We're still in the data collection process. So first things first was we had to define the network. What are the inclusion and exclusion criteria you're going to use to define who is in your network in the first place? This is really hard to do, just based on our own experience. We had a lot of people to sort through, and our project connects with a lot of folks. We ended up, though, with 22 organizations for our training project network. So after that, we sent them a survey asking them to identify their organization and then also identify other organizations they work with within the network. We also asked them for a bit of contextual information. So who else are you working with outside the network, and what are the general benefits and drawbacks of the partnerships? This is the actual meat of the survey and what starts to get at things like measuring density, centrality, multiplexity. We asked them about the types of ties, so informational all the way to integrated ties. Informational ties would be the weakest, so if you're thinking about this in terms of numbers, it would be 1. And that's things like exchanging information or attending meetings with one another. Maybe we just email information every now and again. Coordinated ties is the next step up. Maybe we develop programs together. And then finally, the strongest type of tie would be an integrated tie. And that's when you're sharing things like funding or clients or patients. We also ask them about the frequency with which they are engaging in these types of collaboration, all the way from maybe this is only an annual thing to something you're doing every single day. So here's what we're learning from this. Who in the network is most central? Like I mentioned, I think that's going to be us for the purposes of our training project, but I'm interested to see if I get disrupted when we get some more data. Are the network ties based on more informal relationships, or have they been formalized? To me, this is an important question because if you have a network that is exclusively informational, the weakest type of ties, maybe you don't get as much done, it's not as productive, but if everyone's integrated, then you can't adapt to new challenges or set new goals to work towards together. Are some of the ties stronger than others? And should we try to strengthen weaker ties? And then finally, I think the biggest question and the best reason to do a network analysis is that you can assess if over time the relationships are changing. If you've set out to improve your partnerships, you can see, have I made new ones? Have I strengthened the ones that exist? Or is the network adaptable to our changing conditions and goals? So as we do this iteratively over time, you can visually identify the progress towards new or strengthened partnerships, or you can specifically identify specific constellations of partnerships that are responsive to specific situations. And there's no way to really systematically approach this without doing one of these network analyses. So as educators who value strategic collaboration, I think we should embrace a network analysis, not only because we'll gain a clearer picture of the existing partnerships we have, but we also empower ourselves to build sustainable, adaptable, and strategic connections that ultimately enhance the overall capacity of the network to achieve common goals. So I hope you all consider using this method in your future work. I highly recommend you check out this article by Proban et al. It's where I got the survey template from. And if you have other questions about it, let's connect. See what I did there?